Now, see, we all know that if you look back to the classification stages of heart failure, there are 4 stages: stage A, stage B, stage C, and stage D. All the patients who are either presently symptomatic or all those patients who had symptoms in past but now they do not have symptoms are called as stage C heart failure. That means they have risk factors for heart failure, they have got already structural damage to their heart, and they have got various functional issues as far as heart function is concerned. It's very rare to have a patient who had HFrEF to improve totally in terms of their function of heart improves, their structure of heart improves, and they become normal. It's very, very rare. So most of the patients who get ejection fraction improved, they do have risk factors persistingly there. They do have structural damage to heart also there, and they do have a lot of functional abnormalities also. It's only that their EF has improved, their symptoms have stabilized, but doesn't mean that syndrome of heart failure, the basic pathophysiology of heart failure, is totally corrected. And we all know that ARNI is a drug which works on the pathophysiology. Similarly, beta blockers, aldosterone antagonists, and SGLT2 inhibitors, all these 4 pillars, they work on the pathophysiology. And that's why all those patients who had heart failure with reduced ejection fractions, who had symptoms, now their ejection fraction is improved, their symptoms have disappeared, but you should continue all these 4 drugs permanently. Now, even guidelines, if you look to the SCCH 2022 guidelines, they have a specific mention that all these patients, you should continue all these 4 drugs because they are the drugs which are going to improve their longevity of life.